I've never experienced sexual harassment like within like my workplace or even in kind of that wider, I guess, like at events and things like that. It's not been something that I've had to deal with, which is great, but it's something that I am almost kind of braced for. Like there's a part of me that sees it as an inevitability.
That was Lauren, a survivor of sexual assault, talking about the increased anxiety she lives with as a result of PTSD and how that can show up when you're a female developer working in the tech sector. It's important to say at the start of this episode that while Lauren doesn't share any specifics, we do talk frequently about sexual assault and rape. In this episode of Silent Superheroes, Lauren will give us some ideas for what to say to somebody if they tell you that they've been sexually assaulted. We'll talk about embracing trial and error when you're learning to manage PTSD, and Lauren will share some of the ways her employer has created emotional safety. Remember, Lauren and I are talking about our personal experiences with mental illness. If you're living with a mental illness and you're considering changing your treatment plan, please consult with a trained medical professional. If you have any concerns about your mental health, there are numbers you can call at the end of the episode. My name's James Pratt. I'm the host of Silent Superheroes, and I'm really glad that you're here.
Welcome to the Silent Superheroes podcast, a series of frank conversations about mental health at work.
Welcome to Silent Superheroes. I'm here with today's guest, Lauren. Lauren, welcome to the show.
Thank you.
It seems appropriate to ask you, who are you and what do you do?
So my name's Lauren. I'm an engineer, a full stack web developer working in Australia. Also quite recently became a team lead.
What is it that we're going to talk about today?
I suppose I can talk to you a little bit about my mental illness, my, sort of the path that I've gone through, bring me where I am today. Post-traumatic stress, as I assume most people know, but it's an anxiety disorder that stems from one or more traumatic incidents that have happened to someone in their past. In my case, that was a sexual assault, rape, when I was 15. So quite young, formative years. That being so young, not really knowing how to talk about any of those kinds of things. I guess also having a lot of trouble accepting that is what had happened to me. I sort of ignored it for quite some time, at least a year and a half, before I told any medical professional about what had happened. A year until I told anyone at all. So I guess that's the kind of thing like left untreated, that sort of snowballed a little bit. Became a very, very anxious person, dropped out of high school. I guess even, by the time I actually sort of started being able to talk about it, tell people what had happened, things also just they got worse before they got better, which is quite common, I think, once you sort of accept that this horrible thing has happened to you and you're trying to piece together the world and your place in the world and your understanding of how safe you are and things like that.
So this thing built up for you in the course of a year, and you got to a point where you couldn't ignore it. What was changing over time?
I guess by that point, it would have been around the time that I was leaving high school. I was not coping at school very well at all. I'd previously been not an amazing student, but not a bad one, B average kind of A's in some things, C's in others. I wasn't bad at school. I didn't have trouble with friends or anything like that. I became quite an anxious person. I remember I had this terrible English teacher at one point in a class full of some of the more disruptive students. And he just used to lose his temper and scream at the whole class, basically every class that we had. That was how it would end. I guess that probably would have been around the time that I had started having panic attacks, but I didn't know what they were. I think it was probably not until I was 17 that I actually could understand what was happening to my body when I had panic attacks.
What's been your experience of that? If you could describe what that's like, what would you say?
They sort of range. I guess people who have not experienced panic attacks probably assume that they always feel the same, that they just want this one really, really extreme thing. I have had mild panic attacks and I've had really severe panic attacks. So there's a bit of a spectrum. They can range anywhere from just uncontrollably crying, just seeming quite distressed and inconsolable, up to hyperventilating kind of on the floor in a ball, not being able to speak many people liken them to the experience of possibly having a heart attack. In fact, like people who have panic attacks like later in life and have not experienced them and don't know what they are often do actually think that they might be experiencing a heart attack or something like that, because you get this constricting in your chest and your heart's beating like a million miles a minute. And, there's definitely these physical signs that people associate with heart attacks.
You said it took you a year. What was it that made you feel safe enough to tell somebody eventually?
My mother was the first person that I told, and I wrote her a letter because I didn't know how to say any of it in person. Yeah.
What was her reaction to that?
I remember sitting while she read the letter and like just being in the room with her and her crying. And I think she said something about wishing that she could just wrap me in cotton wool. I mean, she obviously knew by that point that things were not right. And we haven't really talked about it, to be honest. But I wonder if in some ways it was almost a relief to at least know what was going on for her. Yeah, around that time, I mean, I had already, I believe, kind of been to a GP and talked about mental health, not really about what had actually happened, but just things don't feel right kind of thing. And so I think it was kind of a process then of us trying to figure out how we handle my treatment. I mean, I think that she didn't know. None of us knew like what to do. And I think about it, it must be such a horrible thing to find out about your daughter. It seems almost ludicrous, but in some ways I feel like it was easier for me to experience all of that than for someone like my mother to have to hear about it. But I find the act of telling people, and especially the act of telling people that love me and are really, really close to me, actually probably still one of the biggest sort of painful things that I still need to go through. I usually find that once I've had like that conversation once or twice with someone, or if I'm just talking to someone who I'm less close with and I'm less worried about their feelings about it, that I can actually talk about it quite freely, which is great. But yeah, I often find myself managing the reactions of others, which is, I guess, just like a little bit of an added burden that comes with having been through something like that.
I mean, I wonder for you, you've had this thing that you've been living with and wrestling with, and you finally decided, I can't take this on alone. And in bringing it to somebody else, maybe there's some amount of relief there or sense of moving forward, maybe.
Yeah, absolutely. I think I did feel like that. It wasn't exactly like I knew what I thought would change by doing that or, how any of that would go. But there was definitely an element of that. The more I was able to open up to people, for the most part, the better things got. I do think I felt like kind of a sense of relief in at least, reaching out to like one person and then maybe one more person. And it's this slow kind of thing, especially at the start.
So there may be people listening to this who have already, or at some point in the future, somebody that they know and love comes to them and says, I was raped. What are some of the things that person should be thinking about, doing, saying, not saying in that moment?
I mean, one of the biggest things that tends to happen when people come forward with these sorts of things is there's a lot of feelings of guilt, of personal responsibility, of like, is this my fault? So really try like as hard as you can, I think, to steer clear of anything that, even implies that, this person kind of could be at fault. Like you just want to listen, you want to take them at face value, tell them that you're here and that you're happy to, like, maybe not happy is maybe not the best word. You are, you're there to listen to them. However much they want to talk about it is up to them. I think there is a want for people to kind of probe and ask questions and try and understand better. And I think that comes from a good place, but it can also be really confronting, especially if you are one of the first few people that a victim is coming to.
What is useful at the end of that conversation for that person to have happened in your experience? I know that you cannot speak for all victims of rape.
I guess just knowing that there's someone kind of on their side that's there if they need more support, just having someone who is there sort of trying to understand what they've been through. I think also like reinforcing that telling people is a good thing is also quite important. So thank them for telling you. Bravery is the word that I used about like myself earlier. And I think that was a word that my mother had used. And at the time, like, you don't feel that way. It probably took quite a while for me to look back on that and think, oh, you were right. Like, that was very brave.
It was.
I guess having someone say that was helpful, and it's something that I have then gone on to say to friends, and not even necessarily a sexual assault, although sometimes yes, but really helping people to feel like the choices that they've made to tell people are a positive one. You understand that it's really, really hard, and that makes it a brave thing to do.
Grateful that your mum offered you support. One would hope, of course, that a parent would do that, but I don't know all parents would have the right emotional resources to deal with that situation. You went from there to being diagnosed with PTSD, so why don't you walk us down that road?
I don't remember, I guess, a time of actually being officially diagnosed with PTSD, but I saw a few different psychologists. After speaking to the GP, the general practitioner, who I guess a lot of people I spoke to just heard the things that I was experiencing, probably before the panic attacks had become as big a part of my symptoms, and they just kind of heard depression. So my GP put me on Zoloft, an antidepressant, SSRI. I had quite a poor reaction to that. Within the first few weeks of being on it, I then had a suicide attempt, and I guess that was also just a very big trigger of, okay, things are really, really not good. I ended up in the ER. From there was assigned a psychologist at that hospital, ongoing. I never told him about the rape. I just obviously was not at a place to be able to have that conversation with a practical stranger. I didn't really understand the process of therapy and all of those sorts of things. I had a session with a woman outside of that hospital. I think potentially had been referred by the psychologist from that hospital to this sort of associated clinic. By that time, I was self-medicating a lot with cannabis. And I remember having this first session with this woman, going into the waiting room and hearing her shouting at the patient in the room before me and seeing that patient leave in tears, and then going in.
Was that some kind of therapeutic technique, do you think? So I think
I mean,
psychologists as well tell us, is that how that works?
I believe that some psychologists think that is a reasonable technique to use in certain situations. Yes, they're not psychologists that I would
choose to go
seek
to.
out. Yeah. So this was I had not even met this psychologist yet, and this was my introduction to her. And I went into that session. This would become the first medical professional I had ever told. It took me sort of the whole session to I sort of worked backwards. I was like, these are the things that are happening right now. And I sort of worked backwards and eventually told her about the sexual assault. And it was like she didn't even hear it. I would say it was probably 16 at that point, maybe 17. She berated me for the amount of pot that I was smoking, told me that I would never get better unless I quit. She basically could not treat me until I quit. She gave me a number for a quit line in Australia, and she basically just sent me off. She barely acknowledged that I had told her that I'd been sexually assaulted.
It felt like she was almost more concerned with the crime that you had committed, crime in inverted commas, than she was with the crime that was far more important that had been committed against you.
I don't know. I don't know how as a medical professional you can talk to an underage teenage girl and hear that they have been sexually assaulted and say nothing. I don't know. It was baffling to me, and it was very, very damaging to my ability to then, seek out and develop healthy relationships with other psychologists. As I've gotten older, I've had more relationships with psychologists. I figured out how to find, how to seek out the psychologists that will be more helpful to me and will need less of that, me educating them and more them doing their jobs.
Would you mind talking about that? Because I get asked that question a lot. In fact, just the other day, I was catching up with someone I hadn't seen for a while because she'd heard the podcast. She's like, hey, so my GP told me that he thinks I have anxiety, told me to go find someone, but I have no idea where to start. What would be your advice? What would you be looking for? How would you approach that?
In Australia, at least, we have kind of a database. I do things like that. So I use internet searches and whatever of those kinds of technologies that I can find. Often you can kind of search for specialties with keywords like PTSD, trauma, sexual assault. Word of mouth also tends to be quite good. So I usually use criteria like somewhere close, somewhere that's easy to get to, someone that has a specialty in PTSD. Well, almost all of my medical professionals now, I tend to seek out women rather than men.
You've talked about PTSD in terms of being an anxiety disorder. You mentioned that you've had panic attacks. What are some of the other symptoms and experiences you've had with PTSD?
I have things like just an increased sort of general level of anxiety. It's basically like, I don't know, you've had PTSD or something like that for so long that your general anxiety response is kind of heightened. You're more likely to just kind of be at a higher level of kind of cortisol and things like that in your system. So it's things like, being startled easily, like loud noises, being sort of hyper aware of dangerous situations, really strong responses to, and then sometimes like avoidance of depictions of sexual assault in media. And especially if I'm a bit blindsided by something like that, and maybe if I'm having a particularly fragile day, like those things can still affect me quite strongly. I don't really experience panic attacks so much anymore, but it's more likely to manifest in just taking up a lot of my mental space. So it's like I will, read about something or see something and that would just sort of be in my head with me for a day or two or a week, maybe if it was particularly strong. I also have had problems with sleep. Now I manage that quite well. I probably sleep more than the average person, but problems with insomnia. I was pretty much agoraphobic for probably about 6 months, maybe a year, at some of my worst times. That's when I was having a lot of panic attacks, and I felt safe in my house, my sister's house, and like the shops down the road from my house. It's nowhere near as bad as it was, but I still occasionally, like, I'll be at home in my apartment on, an evening, like maybe 8 or 9 o'clock, and think, I forgot to buy milk. And I'll have that thought pattern of like, you're in your nice, like, safe space right now. Are you sure you want to leave? Is it worth leaving your nice safe space? And sometimes the answer is no. Sometimes it's still like, you know what? I'm happy here without that thing.
I'm projecting that if you live with anxiety, it's not just that a decision needs to be taken. It's all thinking around the decision. And then after you've made the decision, thinking about whether it was the right decision or not, right?
Yeah. And it can be very, very exhausting to just be going through those thought processes constantly.
So that's the first part of Lauren's story. When you speak to Lauren, she's confident and funny. It's almost hard to imagine the journey she's been through, from dropping out of high school, telling her mum that she was raped, having bad side effects from medicine that was supposed to help her, and seeing a psychologist she'd heard shouting at other patients. On the way, Lauren had to learn how to manage the panic attacks that come with PTSD. We live in a society where women aren't always taken seriously when they report sexual assault. If there's one thing you take out of this section, it should be Lauren's advice for how to support somebody who confides in you that they've been sexually assaulted. Lauren's advice is listen, show support, and recognize their courage and bravery in speaking up. Never ask questions that diminish the experience or suggest it might somehow have been their fault. As we move into the second part of Lauren's story, we're going to hear more about how she's learned to manage PTSD.
You mentioned that you tried Zoloft and it had some pretty ugly side effects. So where did you go from there? Did you continue with medication, or did that put you off that path?
I took the Zoloft, had the quite common side effect of the increased suicide ideation. Then proceeded to have that suicide attempt, and it was actually the psychologist that I had assigned from the Women's and Children's Hospital that I ended up in put me on something called mirtazapine, also an antidepressant, but often used for people with more of those kind of anxiety symptoms and less of the depressive symptoms, because it can have quite a sedative effect. I was on that for a while. That helped. I've had breaks from it. I'm currently on a very low dose of it right now. I'm not actually sure that I need it right now, but the last time I tried to come off it just to sort of test that theory, the withdrawal symptoms were absolutely atrocious. I was just not coping. I didn't make it through that withdrawal period. And so I went back onto the lowest dose that was not giving me withdrawal symptoms. And I've been on that now for like 2 years because I haven't been able to bite the bullet and try again.
Maybe you could talk a little about how, as you've come onto and gone off these medications, what's that process been like, and what advice would you give to somebody who, is coming off something or going on to a new medication?
So I guess this is advice that I would give people in regards to, we talked about earlier, finding psychologists or medical professionals and things like that as well, is like, it's okay for things to not work, and to accept that they're not working and try something else. And it can be really hard. It's quite an exhausting process to go through, to be trying something and then kind of go like, nope, this is not helping, or it's making things worse. Even I have to try something else, especially with antidepressants that can often take, up to 6 months to be having kind of their full effect on you. But yeah, not taking everything necessarily at face value, being really aware of the side effects that you might experience and which are the sort of the worst ones. Try and define for yourself, I suppose, what kinds of side effects might be acceptable and what might be unacceptable, rather than just accepting it all. I think especially when it comes to antidepressants, that increased suicide ideation and that increased kind of risk of suicide attempt is something obviously to keep a really, really close eye on. It's not something that me, or I believe my mother at the time, me being underage, that we were told about when we were given the Zoloft, and that was given by a GP, not a mental health professional. She in fact gave us samples from the office, so we didn't have an opportunity to talk to a chemist either. So I was angry about that.
As you should be, because you were completely uninformed about, in a very literal sense, what could have ended your life.
There was a period where I was just like, all of these things are horrible. Zoloft specifically is evil because it has this side effect and things like that. And then I had to slowly kind of come to terms with the fact that it was the way that I was put on that, the way that it was prescribed, that were all contributing factors to the reaction that I had to it, and the way that we didn't really know how to deal with that reaction.
When you get any medication in the US, there's 4 sheets of A4 of potential side effects. So this would be a situation where reading that documentation and asking questions, I think, is really, really important.
That's true. And there's also an element of reading that documentation can be really scary, and it can put people off trying something that could be helpful to them. So I don't know. I guess it's about keeping those things in perspective. It's like you said, sometimes that list of things could be totally irrelevant to the things that, to what you will experience. There's really extreme stuff on there that would happen to less than 1% of the people who take that medication. I think it's also about having a trusting relationship with the medical professional who is prescribing the medication, and being able to have conversations with them about side effects and to be able to see them at reasonable intervals within that sort of starting period as well.
For me, I think I would prefer to go see somebody who is an expert in the field, particularly with, mental health, which I think is different than physical health. Just feels like a psychologist, psychiatrist is better equipped to explain side effects, have dialogue about it, etc., etc.
I've usually seen psychologists rather than psychiatrists. I assume the distinction is the same in America, but in Australia, psychiatrists are the people who can prescribe medication. Psychologists cannot legally prescribe medication. I guess I've gotten into a place where I found medications that work, and I have ongoing kind of those prescriptions managed by my GP. But that was, that's something that I'm now comfortable with because I have, I understand my relationship with those medications, of which, as I said, mirtazapine is one, and also Valium. I always have it with me. I rarely take it anymore. I think I've gotten one script of 15 pills for this entire year, and I have not been through them. So
got it. Good.
That's really nice to be in that place.
It's knowing what works for you.
Yes.
Right?
Yeah, absolutely.
Before we dive deep into work, we talked about therapy, or going to see a psychologist, which I think includes some aspect of sort of talk therapy. And you try different medications. You have a couple that, that you have access to right now. What other things do you do to help you manage your PTSD?
So I've done a lot of cognitive behavioral therapy. That was kind of the first psych that I really sort of got along with, and I saw her for many years. That was kind of her specialty. She helped me a lot with just recognizing panic attacks as they were building up rather than as they were happening. Gaining more control over them, partly with things like the Valium, but also with just calming myself down, changing my sort of thought patterns, getting myself into a safer environment, things like that.
That's essentially being more aware of your thoughts and better prepared to deal with them, having a plan in place to steer them in a better direction.
And in some cases, like also there's sort of physical things that you can do to help prevent panic attacks as you feel them coming on. And so they're things like proactive, like hyperventilation. So like something that people will say things like take deep breaths a lot. And that's actually often not the best way to deal with that, because it fills your body with oxygen, which actually kind of increase your level of energy. So it's things like breathing into a bag, or like down into your sweater or something like that. That's like still like long, like kind of slow breaths will help to calm you, but something that doesn't increase the level of oxygen in your blood too much. Something that sort of takes control of your physical response of things. So just like a brisk walk or something like that can be really helpful. Or just a little bit of gentle exercise. Might not be a walk depending on where you are, your situation. I've also done some EMDR, so eye movement desensitization and reprocessing, I believe, which is basically traumatic memories. Reason that we have these responses to them is that we don't sort of process them in the same way that we process a normal memory. They end up being this anomaly that sort of sticks out as being this super important thing that you need to pay attention to all of the time, or you might get hurt. EMDR is the process of recalling a traumatic memory in a controlled environment, having someone control your eye movement to I think it mimics like REM sleep. So you try to mimic the physical aspect of processing a memory whilst actively recalling it, rather than allowing yourself to do it while sleeping. Clinical hypnosis as well, which some people will hear that and think that sounds like a load of hooey, and I was probably one of them to begin with. Like, oh, hypnosis, like isn't that fake? Isn't that like some ridiculous thing that people like use to quit smoking, and it doesn't actually work, but like it does and can by way of like, I guess, similar kind of mechanisms. It's just being in that really controlled environment, sort of either recalling something or actually envisioning something that you might want, or like another version of yourself that is in a better place, and trying to like embed those kind of different way of seeing yourself in the world, different way of kind of experiencing the world. And those are things that don't have as sort of an immediate and like concrete sort of outcomes. So it can be hard to tell if they're working, how well they're working.
What's coming clear to me here is that you said, I thought of hypnosis as some kind of hooey. I think what's come clear to me as we've talked about that or medication is to keep an open mind, because you don't know what's going to work for you. Be willing to try different things to find that combination of things that works for you. I've sometimes described it as like it's a jigsaw puzzle, but it's a jigsaw puzzle that like the jigsaw keeps changing.
Yeah.
You have to find new pieces for it,
Yeah, absolutely. And I think that's a really interesting aspect of my recovery that I have had to learn, is that things that are helpful in some part, like, certain times, often when things are really, really bad, become the things that stop you from continuing to get better once you reach certain turning points. So yeah, like coping mechanisms can become outdated, and then they become really kind of detrimental, and they can stop you from moving forward. So things like the psychologist who told me that I would never get better unless I stopped smoking cannabis. I mean, she was wrong. For one. I got a lot better whilst still smoking. It was actually, I think for me, a reasonably good coping mechanism for the situation I was in. Yet there was still a time when I needed to accept that it was doing me more harm than good, eventually. And by that point, it was like I had gotten to a place where I was doing so much better that when you look around and you see like, okay, which things can I sort of strategically look at and say, this will make a positive impact on my life, those things change. Once you move past some things, like I'm having panic attacks every day, I can't leave my house, like maybe 5 people in the world who I actually trust, and I don't trust anyone else. things like that. You move on from those sorts of things, and then you can start looking at like, it has these side effects that are not great. I wonder what I would be like if I was not smoking, or like my life's practically been on hold for almost a decade. Like I haven't done all of the normal things that someone does in their late teens and early 20s. I'm well enough now that like, okay, well, maybe I should look at studying some sort of tertiary education. Like I should look at what kind of career I might want to have. And some people, I think, find it really, really hard to move past those kind of milestones. And they don't really know how to adapt to like an increased level of capacity because they've been used to it for so long.
Lauren's experience learning to manage PTSD is so similar to other silent superheroes we've heard from. She's needed different tools at different points on the journey. At one point, she self-medicated with pot. At other times, she's used anxiety medication. She's experimented with different psychologists and tried cognitive behavioral therapy and EMDR. And she's learned how to see a panic attack coming on and has tools she can use to manage it. We talk often about the side effects of medication on silent superheroes. And Lauren reminded me how important it is to make sure that you understand the potential side effects when you're trying a new medication. I think some doctors and psychiatrists are good at explaining what those side effects might be, but I think it's equally true that some aren't. So be sure to ask what side effects are the most common and what to look for to detect some of the more serious side effects. If you don't get what you need by asking, go read the documentation. And of course, make sure somebody else knows what the potential side effects are so they can be on the lookout for them too. If a medication's not working for you, it's okay to stop, but make sure you stop under the supervision of your care provider. Lauren's journey is pretty incredible. She describes how she comes from a low-income background and fought to become a software engineer, which on its own is hard and can be even harder if you're a woman. In the next section, Lauren's going to talk about her experiences at work, where her PTSD has shown up and the environment she now works in that's created some emotional safety to be herself and talk about her experiences.
So we've talked about, what has happened to you and the experiences you've had since. We've talked about how you're managing PTSD in lots of different ways. Let's talk about work. How has PTSD shown up in and affected you from a work perspective?
I've been thinking about this a bit, ever since we, had our first chat and I decided to do this. And I find it hard to put into words, I think. PTSD has become such this low-level noise in my life. It's just this accepted thing that I sort of live with. And I find it hard to pinpoint areas of effect anymore, I think. Whereas they used to be really, really clear when it was like, I have a panic attack or, I have this response to this thing. It's now such a more sort of general, always there sort of thing.
Are there situations you find at work that can exacerbate some of those symptoms, whether it's now or in the past?
Before I started working as an engineer, I worked as a cleaner. I was studying software development and working this sort of crappy hourly cleaning job that was in the afternoons that suited me quite well. But there were times there where I would be sort of the only person in an office building cleaning what I assumed would be like an empty office building, but occasionally there would be just individual people like working late. That was sometimes a little bit jarring, like especially if they were men. I'm here alone with this person that I don't know. I think I've gotten much better in this, but I sort of avoid confrontation as like many, many people do. Many people who have no problem with like an anxiety disorder or anything like that also just avoid confrontation because it's not pleasant. I think there's this added element of having an anxiety disorder that you worry if you get into confrontational or stressful sort of situations with someone that I will respond really emotionally, that maybe something could cause me to have a panic attack or just to have this heightened level of emotion that I don't feel like I'm responding in a professional way.
It's interesting that you associate being emotional at work with being unprofessional.
It is, right? And I should preface that I don't think that it necessarily is. And there's definitely times when I've been emotional at work and I have thought that was a reasonable thing. And that I've dealt with other people who've been emotional at work and not thought any less of them or that they were being unprofessional in that situation.
But you are responding to the stereotype, maybe isn't quite the right word, but you're responding to the prevailing perception I think that work is not a place for emotion.
Yeah, I think so, which is really unfortunate
Yeah.
that we feel like that.
Hence this conversation, right?
Yeah.
So we start to understand that many people, live with things that are not immediately obvious, are having an emotional impact on how they show up and their ability to do their job and situations in which they thrive and those that they don't.
Yeah, absolutely. And, and even people who are not suffering from some sort of diagnosable mental health disorder, we just have emotions. It's really not something that I think is healthy to try and completely remove from your work life. But there is a struggle of managing them. And the line that different people have between what they consider to be like professional behavior and what they consider to be like kind of over that line, it's probably shifts. There's a big window, I would say. And some people would say that, you shouldn't be showing any emotion at work.
I feel like the place you work is quite progressive.
Yeah, I would agree.
What are things do you think that are done differently there than in other maybe less progressive workplaces as it relates to mental health?
So there's lots of aspects of what we do that I think would kind of be a differentiating point. The fact that, we are an employee feedback platform. So what we do is empower individual employees and their organizations to kind of have their say and then to consume and respond to that feedback in a constructive way that helps them sort of make their companies better, makes the individual work lives better. We use all of our tools internally. For one thing, there's just that. It's like everyone has an opportunity to give feedback about their experiences at work.
It's not just that there is a feedback platform and that you can talk to your superiors. I think it's also that that action will be taken. You'll know that feedback will be heard.
Yeah, absolutely. And that's a huge part of it is actually when you seek to get useful and honest feedback from people, that's something that they need to see and believe that it's actually going to have some kind of impact, that it's worth their time, that feedback won't be used against them in some way.
Essentially what we're talking about here to some extent is trust and emotional safety.
Yeah. And then I guess beyond the product that we actually kind of make and use, there's all of these sort of different channels and different ways that we sort of support each other. There's just individuals within the company that I know I can go to, and they kind of hopefully know that they can kind of come to me when they need to talk about something. Like it's something that I like about being a person who's quite open about their experiences is that it brings those people out of the woodwork, and they either like open up about, their own problems, or they go like, oh, how do you discover that? Like what? Because I think I might be experiencing something similar, but they just don't really know how to like interact with the medical community or how to seek out diagnosis and things like that. We've just recently started an employee resource group around people with disabilities. It's gone down a bit of a path. It was initially focused around people with invisible disabilities specifically, because that was just what most of us, were suffering from. We made the decision quite recently. It was something that I and a couple other people in the group sort of pushed for us to just open it up to people who are experiencing disability in general. We're doing things like weekly meetings that are just like anyone can drop in and you can kind of share what's going on with you if you feel like it, and just get a little bit of support from people, a little bit of commiseration sometimes. And we're all sort of still just learning how to do that, figuring out like the different kinds of support that different people need based on their personalities and the specific issues that they're working with. It's really hard. Like the first like kind of meeting that we had along the lines of, hey, let's get together and we can share some of the issues that we're working with. I cried several times. Like it was really quite like an emotionally involved discussion. It was a lot of like hearing things about people that either I knew, but I guess I hadn't heard them describe it in such a complete way, or seen it affect them as much. It was really kind of interesting and draining at the same time. I talked about the rape and the sexual assault, but I did it quite quickly. Like it was again that process of managing other people's experience. It was kind of like, yeah, this thing happened, and and then I was like really, really anxious for a while, and like now I'm mostly better, and it's all fine.
Covering a decade and a half of experience in, like three
like
sentences.
5 minutes or something. Yeah.
I find that ability even to say, you know what, I'm having a hard day is really powerful. I relatively new in a position at the moment, and it's very open coming in about the bipolar that I live with. But the first time I felt myself slipping into the depression, I decided I was going to put a note on Slack and say, look, hey, I've talked about the stuff. Here's what's going on for me today. Like, I can feel the start of the grip of depression. You're going to see me probably, just working in corners on my own most of the day, avoiding people. But, I'm here. If you need me, got a question, come find me. That's okay. But just wanted you to know why I might be behaving in a different way. And the team accepted it really well and asked if there was anything that, that they could do to help and support, which was great. And I felt better. And I think I came out of it more quickly because I knew that those people were accepting me for who I was and the experience that I was having. And I didn't have to expend the psychological effort to pretend I was fine.
And I think also, I guess, not having to expend too much of that effort to explain what is happening. I've definitely had experiences at work where I've had a hard time just going kind of gone to my team lead at the time and been like, this is what's happening. I'm not sleeping very well. I'm quite emotional. I'm stressed out. I don't want to take time off because I know that actually being here and having the distraction of work is a good thing. I just need some boring work that I can kind of do in my sleep. Let me just go back to just writing some really boring code and not pairing too much. And I sort of just laid out, I was like, these are the things that I need, and I might come in a little bit later. And because of the sleep issues, my team lead was just like, yep. I didn't need to go too much into exactly what I was experiencing and why, because I was able to tell them what I needed out of my work situation at the time, and they could just provide that, and they didn't need to know the rest. And it was really, really that was an incredibly positive experience that I had.
And there's important points that come out of that for me, which is for many people who live with a mental illness, being at work can be better than being at home and ruminating on your own about whatever you've got going on, right? So even though when I'm depressed, I don't want to be around people, sometimes it's better for me to have something to do, people to be around. And I think the point there is that it should be my choice about whether, do I need to take some time off, whether it's a day or a week to get myself into the right place, or do I not? And that's kind of as the individual, that should ideally be something I understand and I get to choose.
Yeah, it's not always the best thing. I'm talking about manifestations of my anxiety as it stands today. And I think there was so much time when I was not able to work. I was just not mentally in a place where I could be a reliable employee, know that I would be well enough to do that. And I came from quite a low income sort of family. And then, and I went almost day and night from that to an engineering job, moving to one of the biggest cities in Australia. And one of the aspects of my anxiety definitely sort of manifests in what if I get worse again, either physically or mentally. I've had, had some physical problems, and I just kind of understand anyone can just sort of get sick at any time. It's not necessarily something that you have control over. So to some extent, the idea of kind of taking time off at times when I am having, not having the best day mentally, that can really just spiral into those kinds of thought patterns of you can't do this. You're not meant to be in this place. You're not meant to have this job. How it's all going to crumble. You're going to have to move back to your hometown and live with your mom, and you'll be back in that place where I was 3 years ago.
It's very easy for those storylines to take hold.
Yeah.
If I were to give you a magic wand or any kind of implement that can change things with very little effort, you could change something about every workplace, but you can't change the people. What would you change?
When we talk about work and the effect that my anxiety has had on my job and things like that, and I think in many ways it's sort of the other way around. My job has had such a positive impact on my mental well-being, and it's partly the people there are amazing, and I have lots of support, and I work in a wonderful company and all of those things. But it's also just the stress of work. It was nothing compared to the stress of being poor, to be quite honest. That's how I've personally felt. And I know I've met people who feel very much the opposite. Like, I don't want to deal with any of that. I'd rather be poor. And that's their, the way that they feel, and that's fine. But for me, it's definitely been this very, very positive kind of inverse effect. Rather than work having this negative impact and stress, it's been incredibly empowering.
I'm so grateful to hear that, because sometimes it's easy to talk about the things that work kind of doesn't do for your mental health, but it's important to remember that it can have a very positive impact.
It's hard to know if you should share your experience of mental illness in your workplace. It's a very individual situation. I decided to talk about my mental illness at work to create a safe space for others. Lauren and her colleagues created an employee resource group where they could get together and share their authentic experiences. And even having one person you can talk to goes a long way to helping you feel less alone at work. I was talking to an HR colleague recently who was deciding how best to support an employee who was having an anxiety attack. Their instinct was to send that person home. And that's not a bad instinct, but as Lauren reminds us, work can be a positive influence on your mental health. Being home from work can leave you isolated and feeling alone. As always with decisions about mental illness, there's no right answer that works for every person in every situation. If you're trying to figure out how best to support someone who's in a crisis or having a hard time, the best thing to do is ask them and let them decide what's the best thing for them right at that moment. So let's get back to Lauren. As we'd been recording, I'd noticed that she'd flipped between saying sexual assault and rape, and I wanted to understand how she thought about those two words and whether they were different or the same.
I have a clarifying question. I've heard you say alternate between saying sexual assault and rape. And I just wanted to reflect that to you and just see what comes back.
So, as I said, I still have a bit of trouble actually saying the word rape. I don't know that I can explain it particularly well. It's when my PTSD was particularly bad, I had trouble even like thinking about the word. Like it was a trigger for me. It was hard for me to hear someone else say it. It was hard for me to see it like written down or even like as a part of other words. It was that affecting to me. I think I've kind of broken that down quite a lot, but I still feel more comfortable a lot of the time to saying sexual assault, even though it's a much less specific term for what happened to me. I think for one, I don't know, I guess it's quite a harsh word. It's a 4-letter word. It's short. It's very, very to the point. Sexual assault, I think, when I've spoken about managing other people's reaction to what's happened to me and the way that I express what's happened to me to others, I feel sometimes that saying sexual assault sort of allows people to take in some aspect of what I've been through without having to, I guess, be confronted with the specifics of it. Like to allow people to just go like, well, that was sexual assault is already a very, very bad thing in a whole, like, but it's just this big sort of cloud of possible experiences, and some are worse than others. And I guess based on how people respond to that, I can maybe go into more detail or less detail. Or
so it's kind of a stepping stone.
Yeah.
Gives you the opportunity to decide how deep you want to go in that particular conversation.
Yeah.
Thank you. If there was somebody listening to this who had recently been the victim of rape and hadn't yet talked to anybody about it, what would you want them to know?
Finding safe people to talk about what happened to you is really important. If you don't feel like you have those safe people in your friends or your family, like as a first step, there will almost definitely be sexual assault, like counseling services somewhere around you, even if they're, even if you need to access them via like telephone or, if you're in sort of a more remote community. If you're in a city, then like by all means, there will be something. It's not easy, but things like can get better. If you do tell someone and that conversation doesn't go well, it's okay to like shut it down to say, no, I don't want to talk about this anymore and never bring it up with that person again, if that's what you feel like the best choice is. And it doesn't mean that the same conversation will go, the next conversation will go that same way. I've talked, obviously, like throughout the podcast about having some positive conversations and having some really, really negative ones. Like perseverance is probably the biggest key.
If you could, there's someone listening who was managing PTSD, maybe PTSD resulting from a sexual assault, what would you want them to know? What do you want to say to them?
A similar sentiment, like things will get better. Finding good mental health care professionals is really, really valuable. Like we discussed, don't be too afraid to try different aspects of things that might work, but also don't be afraid to let them go when they're not working. It's a lot of trial and error, unfortunately, and it can be a really, really hard path. I think so much of, I guess, my message when it comes to medication and psychologists, like mental health professionals, all of these things, and it comes up a lot with people with sexual assault history, is kind of empowerment. Oftentimes kind of the medical community, interacting with the medical community can feel disempowering in some ways. It's like you have this person who's meant to know more than you do, and they could be very didactic, telling you what to do. I would say be wary of those kinds of relationships and try to build up relationships and find doctors that you can have conversations with, and you can have these like feedback loops that make you feel empowered about your own treatment. Because taking back sort of that feeling of empowerment in all aspects of your life is really important.
You said there was another aspect to work you wanted to talk about. What was that?
So one of my personal coping mechanisms that I have developed, and in some ways I had it well before the PTSD, is just quite a dark sense of humor. And I've like a readiness to kind of make fun of and laugh at some really horrific things. And often it's sort of directed inwards usually. Like I make jokes about myself, my own experiences and things like that. Or there's, the punching up, so you make a rape joke, you want the butt of that joke to be the rapist, like not the victim, things like that. But that's been an interesting part of my personality to manage within a professional setting, because I was very much in a social environment before I started my engineering job where whatever I said was fine. Pretty much everyone knew like my status as a sexual assault victim. There was all of this context around the jokes that I would make. I think I definitely have had a situation or two in a professional setting where I have not really caught myself early enough, and I've gone and I've made like this joke and then realized like, people's reaction is just this one of sort of like horror, and they don't know how to respond. And you've put them in a really awkward position because they can't laugh at that.
Yeah.
They don't really have the context to laugh with me. So, I mean, I've learned to like catch myself a little bit more, like dull that a little bit and find the people that do have the right amount of context and that I can say, hey, I do this. This is one of the ways that I cope with things that have happened to me in my life. And if you are happy to be a part of that, then like, let's do it together.
So being deliberate and conscious of how you deploy your coping mechanisms and with whom you deploy them.
Yeah, absolutely. And I think one of the things I've discovered is that if you get into that situation where you've made this offensive joke, trying to explain to a group of people that it's okay that I made that joke because I'm a rape victim, it really doesn't help. It really just makes things worse. It's super awkward. I probably don't have good advice about how to deal with that situation once you're in it. You probably just need to like swallow your pride and be like, that was a terrible thing to say. I'm sorry.
Maybe just don't get into it in the first place is the advice here. Like, watch where you crack your rape jokes. That's the key here, right? You did a remarkable job there of bringing the full range of emotions through this podcast because we started in a very different place than...
Thank you. Yeah,
we ended. And I appreciate if I could replay a word to you, bravery in having this conversation and everything that you've done to address, an experience that you didn't choose and wouldn't have chosen. So I want to say thank you for being here and being part of the show.
Thank you so much for having me. It's been wonderful.
No worries. Cheers, Lauren.
Bye.
So that's Lauren's incredible story of strength and courage. Mental illness is often brought on by some kind of trauma. I can't imagine what it was like for Lauren to have her sense of safety shattered at such a young age. It's taken grit and determination to get where she is today, and I'm grateful she made the journey. If you've been a victim of sexual assault and you've been silently living with it, I hope Lauren's story encourages you to talk to somebody that you trust. And I think her advice applies to all sorts of different trauma. It's so easy to avoid talking about it. We don't want to be a burden. We fear it'll be embarrassing or that we won't be heard. We don't want people to think worse of us because of the things that have happened to us that are outside of our control. I know for me, my life didn't start getting better until I learned how to talk about this stuff. And I hope you've heard the same has been true for Lauren. Remember, Lauren and I are two people talking about our personal experience of mental illness. If you have something you need to talk about, there are some numbers you can call at the end of this podcast. If you're considering making a change to your treatment plan, please consult with your medical provider. If you like what you've heard in today's episode, please consider leaving us a rating and a review on iTunes or wherever you get your podcasts. If you want to hear more about new episodes as they're released, you can sign up for our newsletter at silentsuperheroes.com, or you can follow us on Facebook at facebook.com/silentsuperheroes.
Take your mental health seriously. If you need to speak to someone, you can call 1-800-273-8255 or text crisistextline.org at 741-741. Both provide 24/7 confidential counseling to people in the United States. Worldwide, visit iasp.info/resources/crisis_centers/. To help others find the Silent Superheroes podcast, please leave a review on iTunes or your favorite podcasting service.